Have you ever experienced a sharp, unexpected pain down there and wondered what might be causing it? It's easy to feel worried, especially when the discomfort catches you off guard. If you're over 60 and dealing with pain in the penis, it might not just be what you think. Sometimes, that pain could be a warning sign of something happening much deeper inside your body, like kidney stones. Yes, it might sound surprising at first. Kidney stones are often associated with pain in the back or side, but they can also cause pain that radiates all the way down to the groin and, yes, even the penis. That's why it's essential to know what to watch out for, especially as you get older. In this video, we're going to discuss 3 key warning signs that your penis pain could be linked to kidney stones. You'll learn why this happens, what to look for, and when it's time to take action. Now, let's get into it. Imagine this scenario. You're going about your day, feeling fine, and suddenly, there's a sharp, almost stabbing pain that seems to shoot down from your lower abdomen to the tip of your penis. It's not just uncomfortable, it's alarming. You might think it's just a pulled muscle or a momentary cramp, but when it happens again, it's hard not to worry. One of the most common warning signs is pain that starts in the lower back or side and then moves downward. Kidney stones typically begin with discomfort in the region where your kidneys are located, right below the ribs, toward the back. As the stone moves through the urinary tract, the pain can shift and radiate. If the stone moves closer to the bladder, you might feel pain not just in your lower abdomen but also in your groin and penis. This pain isn't just a dull ache. It can feel sharp, intense, and even come in waves. Sometimes, it feels like a cramp or a spasm, almost as if something is gripping your insides and refusing to let go. When the pain becomes severe and seems to follow this pattern, it's crucial not to ignore it. You see, the pain often becomes more intense when the stone moves or gets stuck in a narrow part of the urinary tract. The ureter, which connects your kidneys to your bladder, is pretty narrow to begin with. When a stone tries to squeeze through, it can cause excruciating pain. As the stone makes its way down, the pain can radiate into areas you wouldn't expect, including the penis. Now, I know talking about this can feel a bit uncomfortable, but it's important to face these issues head-on. Ignoring the pain or hoping it will just go away could mean missing a critical signal from your body. Kidney stones can lead to complications if not treated, including infections or even kidney damage. So, knowing the signs early on can make all the difference. Another important sign to be aware of is pain during urination. You might notice a burning sensation or feel like something is obstructing the flow. This happens because the stone can irritate the lining of the ureter and the bladder, making urination not just painful but also urgent. Sometimes, you'll feel like you need to go, but only a small amount comes out, or the urge might be constant without much relief. Pay attention to any changes in your urine as well. If you notice blood, even just a small amount, it could mean that the stone has caused a tiny tear or scrape as it moves. Blood in the urine isn't always bright red. Sometimes it looks pinkish or even brownish. Don't brush it off as just dehydration or an unrelated issue. Blood in your urine alongside pain is a red flag that you should take seriously. And here's something that might surprise you. Not all kidney stone pain is severe right away. Sometimes, it starts as a mild ache that you might dismiss as just a bit of soreness from exercise or sitting too long. It can come and go, giving you the false impression that it's no big deal. But as the stone moves, that mild discomfort can suddenly turn into sharp, unbearable pain. So, if you're experiencing a pattern of pain that comes and goes, especially if it moves from your lower back to your groin and penis, it's time to consider whether a kidney stone might be to blame. It's not about jumping to conclusions or panicking, but rather being mindful of your body's signals and taking them seriously. Taking care of your health means staying informed and knowing when something isn't quite right. No one wants to deal with pain, but being proactive can make a significant difference. Now that we've discussed how kidney stone pain can start in the lower back and move downward, let's take a closer look at another warning sign that might surprise you: nausea and vomiting. You might wonder, what does feeling sick to your stomach have to do with pain in the penis? The answer lies in how your body responds to severe pain and internal disruptions. When a kidney stone starts moving through your urinary tract, your body perceives it as an injury or a significant problem. This can trigger your nervous system to react, causing symptoms like nausea and even vomiting. It's not that the stone itself directly causes stomach issues, but rather that your body is reacting to the pain and stress. Think about it. When you've had intense pain before, like a bad headache or a sudden injury, you might have felt queasy or even lost your appetite. The same thing happens when a kidney stone is making its way through your system. This is especially true if the pain radiates toward your groin or penis, adding to your body's sense of discomfort and alarm. So, if you've noticed a combination of lower back pain, groin pain, and sudden bouts of nausea or vomiting, it's a good idea to pay closer attention. Don't just assume it's a stomach bug or something you ate. If the pain and nausea occur together, it could point to a kidney stone trying to move through your urinary tract. Now, here's another important point: the urgency and frequency of urination. Kidney stones can irritate the bladder and the ureter, leading to a constant feeling that you need to go to the bathroom. You might find yourself making more trips to the toilet, only to produce a small amount of urine. Sometimes, the sensation of needing to pee is so strong that it's almost uncomfortable, but when you finally sit down, hardly anything comes out. This feeling of urgency can be especially frustrating and confusing. You might start to wonder if you're dealing with a urinary tract infection or prostate problem. While those are possibilities, combining this symptom with pain that radiates from your back to your groin and penis makes it more likely that a kidney stone is involved. Here's a tip to help you distinguish between a kidney stone and other issues. Pay attention to when the pain starts. If the pain intensifies when you're moving, bending, or changing positions, it's more likely related to a stone moving through your system. On the other hand, if the pain is more constant and doesn't fluctuate as much with movement, it might indicate a different kind of problem, like an infection. Another telltale sign to watch out for is cloudy or foul-smelling urine. If a kidney stone is causing irritation or blocking the urinary tract, it can lead to changes in the urine's appearance and odor. Sometimes, you might even notice that your urine looks murky or has a stronger, unpleasant smell. This happens because the stone can cause minor bleeding or even set the stage for an infection, leading to a change in urine quality. If you're experiencing these symptoms together, sharp pain that moves from your lower back to your groin and penis, nausea, frequent urges to urinate, and unusual urine appearance, it's time to take action. Ignoring these signs won't make them go away, and delaying treatment could lead to more serious issues. You might be tempted to just push through the discomfort and hope it goes away on its own. After all, sometimes aches and pains do pass without intervention. But kidney stones are different. If left untreated, they can lead to urinary tract infections, kidney damage, or even complete blockage of urine flow. These complications are especially concerning as you age because your body may not bounce back as easily as it once did. It's completely understandable to feel hesitant about seeking medical help, especially if you're not sure whether it's really something serious. But remember, it's always better to be cautious and get checked out rather than taking a risk with your health. A simple urine test or imaging like an ultrasound can usually determine whether a kidney stone is present. If you do have a kidney stone, your doctor will help decide the best treatment based on the size and location of the stone. Sometimes, drinking plenty of water and taking pain relievers can help the stone pass naturally. In other cases, medical procedures may be needed to break the stone into smaller pieces or remove it entirely. You don't have to go through this alone, and you certainly shouldn't feel embarrassed to talk about it. Penis pain linked to kidney stones is more common than you might think, especially in older adults. Addressing the issue early not only saves you from prolonged discomfort but also protects your overall health. When your body sends you signals like pain and discomfort, it's essential to listen and respond with care. Your health is too important to ignore, and taking action now can prevent more serious complications down the road. Remember, early intervention is the key to feeling better faster and avoiding unnecessary health risks. You've made it this far, and that means you're already taking a proactive step toward better health by learning about this topic. Don't hesitate to reach out to a healthcare professional if you're experiencing these symptoms. Piece of me. Now that we've explored the pain, nausea, and changes in urination that can signal a kidney stone, let's talk about one of the most alarming symptoms: blood in your urine. Seeing even a small amount of blood when you use the bathroom can be unsettling, but it's crucial to understand why it happens and what it could mean. When a kidney stone moves through your urinary tract, it can scrape or irritate the delicate lining of the ureter and the bladder. This irritation can cause tiny blood vessels to break, leading to blood mixing with your urine. Sometimes, the blood might be barely noticeable, just a slight pinkish tint or a few streaks. Other times, it could appear darker or more pronounced. Now, I know what you're thinking. Isn't blood in the urine always a sign of something serious? It's understandable to feel worried when you see it. The important thing to remember here is that while blood in the urine can indicate a kidney stone, it can also point to other conditions like infections, prostate issues, or even something more serious. That's why it's essential not to jump to conclusions, but to get checked out by a healthcare professional. If you notice blood in your urine along with the sharp, radiating pain we discussed earlier, it's more likely that a kidney stone is the cause. But don't rely on self-diagnosis. The best way to know for sure is to get a proper medical evaluation. A doctor may perform a urine test to check for blood and other abnormalities or use imaging techniques to identify the presence and size of the stone. Dealing with blood in your urine can feel frightening and stressful, especially if it's the first time you're experiencing it. But remember, your body is just signaling that something needs attention. Sometimes, kidney stones can pass on their own without causing further harm. Other times, they might need medical intervention to prevent complications. It's also helpful to stay calm and remember that early detection makes a difference. If it is a kidney stone, catching it early can lead to less invasive treatments and a faster recovery. On the other hand, if it's something else, knowing sooner rather than later gives you more options for care. Now, while you're managing these symptoms or waiting for a diagnosis, there are a few things you can do at home to ease your discomfort. Staying hydrated is one of the most important steps. Drinking plenty of water can help flush out the stone and reduce the risk of it getting stuck. Aim for at least 8 to 10 glasses a day, unless your doctor advises otherwise. Warm compresses on your lower back or abdomen can also provide some relief from pain. Gentle movement, like short walks around your home, might help the stone move along more smoothly. Avoiding caffeine and alcohol is also wise, as these can irritate your bladder and make the pain worse. Some people find that over-the-counter pain relievers like ibuprofen can help manage the discomfort, but always check with your doctor before taking any medication, especially if you have other health conditions. As you go through this experience, it's okay to feel anxious or frustrated. Health issues can be overwhelming, but facing them with knowledge and a plan makes a big difference. Lean on your support system, family, friends, or even online communities where people share their experiences. You might find comfort in knowing that you're not alone and that others have successfully managed similar situations. Remember, kidney stones are common, especially as we age, but they are manageable. Taking small steps to care for yourself, staying informed, and seeking help when needed shows that you're proactive about your well-being. One more thing to keep in mind is prevention. Once you've had a kidney stone, you may be more prone to developing another one. Your doctor may recommend lifestyle changes or dietary adjustments to reduce the risk. For example, cutting back on foods high in oxalates, like spinach, beets, and chocolate, might be suggested, as these can contribute to stone formation. Increasing your intake of calcium-rich foods can also help because dietary calcium can bind to oxalates in your intestines, reducing the amount that reaches your kidneys. Don't forget the importance of regular checkups. Keeping your kidneys healthy is not just about avoiding stones, but also about maintaining overall wellness. Regular blood pressure monitoring, diabetes management, and staying active all play a part in keeping your urinary system functioning well. You've done a great job so far by staying engaged and learning more about this important topic. Taking your health seriously and being informed puts you in a stronger position to handle whatever comes your way. Your well-being is worth the effort, and taking steps to address your symptoms shows that you care about yourself and your quality of life. If you found this information helpful, don't forget to hit the like button and share your thoughts in the comments. Your experience could help someone else who's going through the same thing. And if you're new here, consider subscribing to our channel for more tips on staying healthy and active at any age. Your health journey doesn't have to be daunting. We're here to support you every step of the way. Stay positive, stay informed, and remember, your health is your most valuable asset. Take care of yourself, and we'll see you in the next video.